Good afternoon, everyone, and welcome to the Schulich webinar series on shaping the post-pandemic world. Over the next 2 months, and hopefully by the time the pandemic may have passed, we will be bringing thought leaders from Schulich to talk about various topics related to the impact of the pandemic on various aspects of business as well as society more broadly. The reason I am so excited to present Professor Matten is that he's one of the few scholars who has basically transcended both academia and the corporate world. And this is reflected in his more recent award for a paper that he published 10 years back. And it is the most influential paper on corporate social responsibility in the last 10 years. And more importantly, last year, he was also ranked 44 in the top 100 corporate social responsibility influence leaders around the world, which included mostly business. He was the only academic to be on that list. So it's a great honor for me to welcome Professor Dirk Matten and give him the platform to share his thoughts about COVID and corporate social responsibility. To you, Dirk.
Good afternoon, everybody, but that only applies to those in Canada, since I've seen many other people joining. So good evening to those in Europe and good night to those in Australasia. It's a wonderful opportunity. Thank you all for joining. I'm very happy I don't need to use this, let alone this, by talking to each other, since we have this great team here doing the electronics. Without further ado, I want to get into my presentation, technology. Here we go. So I want to talk about how this epidemic, this pandemic really changes and puts new challenges to corporate social responsibility. So here are the two main topics I want to talk about. I think this epidemic brings the topic of risk to the core of what corporate social responsibility has to deal with. It has been a topic in CSR for a long time. Risk management was one of the business case related, brand protection and all these things, areas of CSR, but we will first have a look at that. The second, I think, we see a renewed focus on the social role of business, as in its core economic functions and what the social role and social benefit of that constitutes. Now let's move on to the risk aspect. In some ways, it's an old topic. It was very vibrant in the 80s. Those of you who know the work of Ulrich Beck, Anthony Giddens in the academic circles, it has been very much coined under the topic of risk society. I just throw this table out. We can, if you like, come back to aspects of it. The central point being that we are living in a phase of modern society where we face a different sort of risk, as in industrial society, what we refer to as modernity in sociology, and let alone pre-modernity. So what is the main aspect here applied to the COVID pandemic? First, there's uncertainty about the origins. Yes, we know it, and that's what we are told, originated in some wet markets in China, but there's still uncertainty about it. If you just look into today's Financial Times, there's a great article about it. Second, we are not yet entirely sure what treatment options we have, how the symptoms work, why it affects mostly people who are older, not so much kids. And we are also very, very uncertain about the first and second order impacts. Now, the first order impacts means what does it actually, how does it affect the body? Are there long-term consequences? Will people be immune once they survived it? But also, most notably, the reason why we sit all at home here, the second order impacts on the economy, on society, on democracy, and a whole host of other things. The problem with these risks of modern societies, of the risk society is, and the debate started with nuclear power and global warming, that there is yet a low probability that these catastrophes actually happen, but when they happen, they are high consequence beyond what traditionally insurance can cover. And we see this very clearly with the way certainly governments have reacted to this. If you look at deaths from road accidents, for instance, compared to death through coronavirus in Canada, that's a much higher risk. But since we have probabilities and we know the consequences statistically, there's a very different way to deal with it. There's the problem that also individual agency is limited. They just come with a global lifestyle, and unless we change our lifestyles, as we do now for a couple of weeks here in Canada and other parts of the world, we cannot address this. The main point is that the responsibilities for dealing with these risks is fuzzy. There's no institutions in modern societies to deal with many environmental risks. They are organized around wealth distribution. Risk assignment is an ungrateful task. It's an organized irresponsibility. We will come back to that. Now, what does that mean for CSR? The thing really is that business, and so far what we know about the origin of this risk, comes from a marketplace, small businesses. But also, if we look down to how to address it, face masks, ventilators, business is viewed and perceived due to its financial and technological power as the locus of this. The key implication of this risk debate then is that we enter what Beck called the sub-political arena. So an arena below official politics, where business, civil society, together with government, hash out and have some bricolage around political solutions and societal approaches to this. And we see this unfolding. And that, of course, puts business in a very interesting position to focus more on these tri-sector, business, society, civil society, government collaboration. If we look at the second aspect, I just suggest this pyramid of Archie Carroll, which some of you know from their strategy course, where Carroll argues we have 4 different levels. I'm going to discuss them one by one, which we have seen as a strong reaction that many corporations have donated, often with difficult trade-offs. So Canadian Tire here in Canada gave face masks, 12,000 face masks to medical staff, the government of Ontario, while when you go to their shops, not a single of their employees wears a face mask. So that's a very tricky situation. If you look to the ethical aspects of social responsibility, the thing really is that we find it very difficult to say how far does what we call the precautionary principle really carry. When do we end the lockdown? Interesting debate currently. If you look just at today's newspaper, there are very different ethical arguments made here. And how do we value trade-offs between economic survival of people and the threat of picking up the virus? It is very much also an arena where, if you look for instance, at what some countries have done, look at the consequences as a judgment for ethics. So some countries, Sweden is an example, other could be named, have said, okay, the potential impact of lockdowns is probably more harmful than allowing a few people to die. But that clashes, of course, and no government can say that, with the fact that if you can prevent the loss of human life, you are in a difficult situation. The legal responsibilities of business, of course, we have seen some companies taking advantage of the legal framework that has changed so quickly. Adidas is an example. But what we mostly see is that the response and the success of business and governments and civil society reacting to the catastrophe reflects formal, mostly legal and informal institutions. So in the United States, the pandemic hit a healthcare system which was already underfunded and largely privatized. In countries, think of Europe, and also the East Asian countries like Taiwan and Korea, they had well-functioning, well-funded healthcare systems in place. That has particularly shaped the reaction of business here. Now, my main point, and we are coming to the close here, is that the key social expectation at the moment on business is not necessarily these three prior aspects. They are coming up, but to provide first the healthcare solutions, but then also provide the food and other essential services we are having. So the key stakeholders here are actually consumers and employees. There is a big elephant here in this debate in the room, which is that we read, if you go to any newspaper you pick to their website, a lot about the effects of the lockdown. There's very scant coverage of how to actually solve the problem. And that's, again, something where the key competency lies with business. I cite here one of the key experts from the UK, the CEO of the Wellcome Trust, who argues that it would need 8 billion to coordinate business and, of course, also government labs to develop a vaccine, which is paltry in comparison to what, say, just Canada has spent in the last couple of weeks on dealing with the consequences. So why is that not happening? Research capacities are privatized, business owned. There's patent protection, global intellectual property rights regimes which prevent companies from collaborating and sharing resources. And there is also the fact that who is affected by the pandemic are often people who are not necessarily able to generate the profits. It's a long-standing debate we have had about the diseases of the poor, but it really shows that corporate responsibility, as much as you can donate, ultimately here faces its barriers through the business case dominance. Now, what does that mean for the future debate on CSR? In my view, it exacerbates what we have seen for a while, that all these business case driven thoughts about social responsibility are really at the end. This type of CSR, which is predicated by the business case, that's over. The limits of this type of CSR are systemic and reflect the current crisis of capitalism, where most provisions of goods and services, and currently, if you just think of food security, we see that social value and benefit of what business brings and can bring if this is only predicated on profit maximization and shareholder enrichment, there is limits to the social responsibility of business. We can only fix that if we come to systemic changes. And if you look, there are a lot of coffee cup readers who think this will now happen. But we also have to see that business has to move beyond first order consequences, beyond philanthropy, beyond just what is immediate at stake, but work on a new institutional frame that would look at business providing societal benefit in a way that is embedded in institutions, which has been a long-standing interest of mine. CSR in that respect sees business more as involved in the governance of society. We saw a bit that in the pandemic, that businesses here and there made a contribution, changed the way they produce, for instance, certain goods, ventilators, masks, and others. But by and large, we are still far away from a business assuming this role systematically. And with these thoughts, I pass it over to you. The first question is, will the slides be available? Yes. Second question I would like to pick is by Christina Liu about the impact of the pandemic on the tourism industry. Now, I think short term, we see very well what is going on. It might indeed get to a point where, at least for the foreseeable future, yesterday Harvard published a study that this might go on for 2 years, will have severe impacts on tourism. We might definitely see raises in transportation costs, so traveling abroad and far away might get significantly more expensive, not at least because I think the tourism industry has to make a more severe precaution towards the spread of the coronavirus, if we like, but experts say this is just the first taste of what the pandemic really could be. So this is really a game changer for the tourism industry. It definitely might get more local, it might get more sustainable, and it might get more high-end. So there's a question about philanthropic activities by corporations, about their effectiveness by Martin Martens. Well, that's really Milton Friedman's old point, right? That he says managers have no idea what to do with the social good. They are trained to run businesses. And that is partly true, but what we see increasingly over the last 20 years is that corporations, when they become engaged, either build up specially trained departments to deal with it, or partner with NGOs or other civil society resources, so that this argument is not necessarily carrying water. Of course, there are a lot of companies who, through their foundations or their owners, do this to avoid taxes. At the end of the day, what we see then here is often referred to as philanthrocapitalism, which is basically a capitalist system which makes few people, the 1%, very rich, while those allocation of resources which are generated by tax become more and more scarce. So there is really a democracy deficit in this philanthropic engagement, which again points back to my fact that I think we need to come back to a different system of capitalism, and redistribution of wealth is certainly one of the things we will face here. Well, there's another interesting question, of course, given our global audience, about the aspect of different models of CSR emerging in developing versus developed countries in the light of COVID-19. Now, the general answer for that, of course, is, and my former PhD student, Wayne Visser, has published a nice paper, you can Google it, on this, that the pyramid of CSR, which I used, is very much a Western, if not a North American model. In developing countries, next to the economic responsibilities of business, the most important, the second level, is philanthropy, because in many, and the Priyanka's question, I guess, comes from the subcontinent. If you go to India, you see that many of the large conglomerates basically do welfare state emulation. So I would say that the role of business in addressing this is very important, just to provide the resources. And if you see what Modi's policies this week have been, this will be not addressed by government. This will be addressed by civil society in collaboration and funded by business. So I would see the main difference in that respect. There's an interesting question here about how long I see the pandemic going. Now, this is coffee cup reading, and that's exactly why I focused on risk. Nobody really knows. I refer to the Harvard study, they say 2 years. That's all very uncertain, and that leads to, you know, business to think in scenarios and to work with different assumptions and adapt their scenarios and planning as these assumptions change. If we really get our act together and get a vaccine, this might have a rather speedy end, but I just mentioned that certainly business is not living up to its responsibilities in doing anything on that front which would change the game. So there's a question by Ragib about the fact how companies should react post-crisis, whether it's more internal transformation, moving away from philanthropy. I think that has been an ongoing trend and will be stronger. Yeah, CSR not as bolt-on, which is basically value distribution, but CSR as part of value generation. And we see at the moment that the very role of business and the reason it exists is to provide us with essential services. The whole focus of seeing a business as just profit generating is an invention of the last 40, 50 years. And this definitely has to go, but it points also for me to the fact that maybe the key change for CSR is not necessarily so much internal in corporations, but in corporations engaging and being participating in corporate governance. If you look around the world, it's a very interesting thing to see that business has been most effective in two sorts of regimes. First, authoritarian regimes, whatever we think otherwise of them. China is now providing medical equipment to the United States. How ironic is that? Turkey is the biggest provider of face masks and ventilators to Italy, Spain, and other European countries. Who would have thought? But you secondly see that countries who have a strong corporate system between with close connections between government, business, civil society, mostly labor, if you look to Europe, have been much more respondent and have put business in a situation where they could respond much quicker to this situation. So in that sense, the key answer and the key change I am advocating and I'm expecting to see in some ways is systemic, not focusing on the individual company. Okay. Yeah, there's a question here by Jette Knudsen. What do we think about companies that have given some donations, like Amazon, but at the same time don't look seriously after protecting their workers, and that includes companies, in the case of Amazon, who have even received government support as the US bailout plan. Now, that again points to the systemic problem. These philanthropic donations, as good as they sound, and 50 million is great, but Bezos just made, I think, 20 billion in profits in the last 4 months through the lockdown effect. Now, this is paltry, of course. And it points to the fact, what we discussed a little earlier, that there is something seriously wrong in the taxation system. And it's not just that. We will have a webinar on inequality, so I don't want to go too far down that line, but it really points to the fact that we have to change the system, and a political system which is often shaped through lobbyism and business influence. And of course, that is something that is inherently unethical, because it undermines the democratic process in this context. Well, there's an interesting question here by Matthew Johnson, who asks whether we are now coming towards a sustainable utopian future due to the pandemics, and if we can move from a reactive to a proactive behavior. I'm a part of the task force who consults the city of Toronto on climate change. Now, that topic is not very high on the agenda right now, of course, and local politicians have other things to deal with. The thing here really is that, of course, at the moment, we have to mostly react to these things short term. And that is indeed a worrying situation, because the reactive measures we see are very, very authoritarian. I don't see longevity in changing the level of funding, for instance, in the Canadian healthcare system. People are dying here in Ontario in old people's care homes at an unprecedented scale. But that has been a problem for the long term. We need to rebuild welfare state institutions. Many argue also that the handouts now from the government here in Canada could be translated long term in something like a basic income. All these measures, I think, depend really on civil society and, of course, governments prolonging these effects, and the enlightened self-interest of business that these issues need to be addressed. Healthcare and better funded public infrastructure, be it health, transport, education, is something that they have a long-term interest to support it as well. And it is just, I think, one of the silver lining at the horizon, that these things might indeed be the outcome of it. I'm cautiously optimistic that this pandemic now has changed many of our assumptions about the role of governments. Yeah, there's an interesting question. Brian Weber asks, do you really think that business and government have enough trust to collaborate, particularly in the US? Well, this, I think, is very much a question you can only answer almost country by country, I would say. And what you say about the US, I wouldn't necessarily call it a trust problem, but a problem of basically government capture by business. If we look at, certainly after Citizen United, which allowed governments to fund limitless, in a limitless way, political campaigns, that basically major political processes and decisions are heavily influenced by business. So I think that's the main problem here. If you go to other parts of the world, you see that the relationships between business and government are much closer and much more done on a collaborative way, and in a way that balances these interests. And we have seen these things not just recently in how companies, for instance, in Europe or in East Asia reacted to the pandemic, but also down the line in questions of environmental protection, waste management. So it really depends on the regional and country setting, I would argue. But the thing is that these things are not cast in stone. The relationship between business and government in the US is a question of legislation. And these things, so it's a political question. It didn't fall out of the sky. And so these things are not God-given, they can be changed. And if we look at the last 250 years of political systems in many countries who are today liberal democracies, these changes eventually happened with enough mobilization on the ground. So in that sense, I think it is very much a political process, and you see the rise, even though Bernie is now out of the race in the US, but the support and the momentum behind these kind of ideas is growing. The problem with that, of course, if you look to Europe, is that this, of course, it can go to the extreme left, unfortunately also to the extreme right. So where this is going in other parts of the world, I have no idea. Yeah, there's a question about the patent process in the pharmaceutical industry, which could come in the way of making the vaccine available to the masses. I think we need to generally rethink the way we have organized pharmaceutical innovations. If you look at the key inventions and the key medications and key contributions to public health, to the fact that we have a longer life, to fight diseases that have ravaged Europe, North America for centuries. These were all inventions, if you think of Pasteur and Koch and others, done in publicly funded laboratories. So I think patent protection is a huge problem, and the privatization of pharmaceutical research, yes, gives us Viagra, but it doesn't give us something that addresses malaria. And again, philanthrocapitalism, Bill Gates tries to address that, but he is basically an unaccountable neo-feudal person who can decide what to do with his money. Luckily, when he does something that most of us would think is beneficial, fine. But I think the way patent protection now works, if the vaccination is, let's say, found by one private company, this will be a very big problem. And that refers to a question I saw ago, that will put companies, of course, in a very tricky ethical positions, because they then have to decide basically who shall live and who shall die, because no single company will be able to provide the medication for 7-8 billion people at once. So this is highly problematic. And again, once we have it, raise a difficult and different CSR discussion. I think that the solution really can only be collaborative and done with some form of public administration that, yes, regains the costs that individual companies had in developing these, but also keeps prices at a level that makes them affordable. And there's discussion about that this is possible. But patent protection will put a limit to that because the demand will be so high that companies really can, of course, make first mover advantage profits in an unprecedented way. Well, there's an interesting question here about whether this changed role I have been arguing and trying to use the pharmaceutical industry as an example could also apply to the financial industry. And the short answer is yes. I mean, even in the US, but still in many European countries, either federal or municipal governmental bodies still operate savings banks. In the US, it used to be the mortgage industry, very much dominated by government-owned and run companies. I don't think that the financial industry as such has any ethical or is inherently unethical. But I think if you think of the financial crisis 10 years ago, of course, there are limits to government oversight. I think that will be a very important factor here, more collaborative relations between business and government. And certainly in the US, we have seen anything but that. And moving towards a model that, like we still have in Canada, banks are cooperatively owned, that the benefits of financial services are distributed more evenly and things like that. So it is pretty much the same approach. And it might also, for instance, thinking of cooperatives, again, point to the fact that we don't need necessarily more philanthropy from banks. We don't need another Scotiabank arena, or we don't need any more philanthropy, as beneficial and nice as these things are. There's nothing wrong with that, but it's a systemic question. It's the question how these and in whose interest these banks are governed, and that changes everything. Well, there's an interesting question here to the directed at the value creation outside of profit and how to measure it. Now, that's certainly something which my accounting colleagues who will be coming later in the series will be more competent to answer. But the short answer to this is, and it has already started in parts of the CSR community, that if you consider social investing, if you consider benefit companies, if you consider social entrepreneurship, you want to actually also find out what social value you actually create. The tricky thing with that, of course, is that there will be no common currency, because how do you compare, let's say, environmental protection? Yes, you can measure CO2 and other things here, but if you invest in local education in Bangladesh, now how do you measure the impact? You have to develop new measures and new comparable standards for that. And that's in some ways the holy grail or in this part of the corporate social responsibility movement. And I think the more companies, even now in the pandemic, companies become engaged in social activities and are measured against their social benefit and contribution, there will be more need and more interest in generating these standards. But I don't think it will be translating in a common sort of alternative currency. Eventually, I think there are standardization efforts at hand. GRI, Global Reporting Initiative, is one example, but they are in an early stage and they all struggle with the comparability of these different social, environmental, and ethical goals. So there's an interesting question here about focusing on employees and how far the fact that we now are all work from home it will change patterns of how companies work, and whether that will be going on, and if we all end up in some gig economy work style. I have to say that I'm very skeptical about that. It might be that we see a little more of this. That's possible, that there will be sort of some atavistic impacts of this. But I have to say, I miss my colleagues. I miss social interaction. Hanging in front of your screen at home is not very healthy. And I have to also say, as someone said in a newspaper, there's a lot of productivity porn going on at the moment, i.e. people pretending that they are so productive at home, when in fact they aren't. And it is much more difficult, even if you do work that I do, to do it in absolute social isolation. The other thing, of course, is if I want to do a webinar in my house with 2 small children, I have to send them out. It's very distractive to work from home. So I'm very skeptical that this is going on in the way it is going on. There might be slight tweaks, but by and large, we are human beings and as such social beings, and we need this face-to-face interaction. It won't change. So there's an interesting question here. Do you think this pandemic will lead to more investment in the healthcare industry, not just now, but also in the future? Coming from Pooja Kumari. Now, I think that certainly with regard to preparedness to pandemics, we will see some investment. That this is really a crucial moment. Certainly for healthcare systems that are mostly run by governments, this 250 billion the Canadian government spent now on the pandemic consequences, if they had allocated that a little earlier in their healthcare system, they could have saved a lot of money in the long term. So I think that is certainly something we will see. What really depends on the political process, whether that will also extend to other areas, not at least the level of pay of nurses and doctors and other hospital staff, for instance, in the breadth of caring for other diseases and so on. That will still remain very much a question of the political process. And again, I think business will play a key role here in providing many of these services at an affordable level. And the debates, for instance, around pricing of pharmaceutical products is one of the core debates here, and we will see that the challenge to corporate responsibility from that angle will be ongoing. Okay, over to you, Preet.
Thanks, Dirk, for your presentation and for your insightful answers to a lot of the questions. you were able to get through a lot of them, and I see that we still have a lot more questions. So what I would urge our audience is that we have a number of new webinars, and maybe some of these questions you can pose to our the speakers as we move along in the next month or so. So thanks, Dirk. Before we end our webinar, I want to bring a couple of things to your attention. One is the upcoming webinar, which we have on Monday, April 20th. And here we kind of move from to the broad philosophical and issues regarding corporate social responsibility to the more nitty-gritty of dealing with different business aspects to this COVID. So we have Professor Amin Mamani, who will be talking about the Canada Emergency Wage Subsidy and its impact on businesses. So please join us on Monday, March 20th at 1 p.m. Second, I want to reiterate to all our potential alumni or potential students who are looking for education opportunities that Schulich is open. And so if you can connect with us, and here there are a couple of sites from where through which you could send us the inquiries or connect with Schulich. So we are open. And anyway, thanks again, everyone. Thanks, Dirk. Thanks, Vito. And I look forward to seeing most of you again next week and the weeks to follow. Thank you.